Yeah, I'll use it. It's water bottles. Thank you. Okay. About 2 weeks ago, I received an email from a supplements company called The Wellness Company, and it was promoting a new product that they were releasing called Drop. And it's promoted as a weight loss supplement. Now, interestingly, it is a version of retatrutide. And what's fascinating about that to me is retatrutide is currently in stage 3 trials by Eli Lilly and Company. So the Wellness Company was founded a couple of years ago by a group of contrarian anti-vax doctors and under the guise of a CEO who comes from a logging and aviation conglomerate family in Canada who has been trying to break into the supplements industry for a while. And I saw the email and then I started looking at it and I'm like, why would they be selling retatrutide when it hasn't been FDA approved yet? And then I wondered, how are they able to sell a non-FDA approved drug? And so that's what I want to get to in this talk and kind of use it as a heuristic for understanding both the wellness industry, which is something I've spent decades of my life in, but also talking a bit about the pharmaceutical industry and healthcare in general. They told me when I was first considering coming here, well, as soon as I got the email, I was like, I'm going to come here. This is fantastic. Little did I know that people gather at 8:30 in the morning. I am a morning person, so this makes me very happy. The last time I spoke in Portland was at Powell's when our book came out, and that was at 7 at night, and I'm usually sleeping by then. So they told me that anecdotes are important, and most, if not all of you, don't really know me. So I'll just briefly explain how I got to talking about this topic. In 1993, I went to college, Rutgers University, and very shortly after arriving, a friend of mine handed me a copy of the Dhammapada and the Bhagavad Gita, and then another friend gave me some psychedelics. And so going to college as a business major, I ended up majoring in religion and focused on Eastern religions, and I was fascinated by the topic. Predominantly the stories that people tell and the communities that form around them, not necessarily the theology, but more of how people practice their morals and live out their lives. Now, as with anything, shortly after graduating with a degree in religion, I started working at the Olive Garden. And then I started a career in journalism, which I actually did for 4 years while at Rutgers. I was writing for the school newspapers as soon as I got there. But for 2 years, I worked as the religion columnist for the Daily Targum, which was the main paper there. And part of my extracurricular work there was going around and interviewing all the different people from the campus faith organizations. And what I found fascinating was I would talk to somebody from this faith and this religion and this one, and they all thought they had the right one. Now, they had a lot of good ideas within them, but that started raising my critical ear. Because if everyone has the right one, then really no one has the right one. During this time, I've been playing sports my whole life. I've been involved in fitness, and that kind of leads into how I got into wellness. So I started studying seriously the philosophies of yoga well before I got on a yoga mat. But eventually I did get on a yoga mat because I've broken numerous bones from playing sports. My femur, my ankle twice, my collarbone, my nose twice. I'm also a cancer survivor. I've spent a lot of times in hospitals. And while in college, I also spent 2 years working in the emergency room monitoring suicidal patients. So I spent a lot of my youth and then into my adulthood in the healthcare environment, both as a patient but also as a worker. So I have a deep appreciation for healthcare workers. Now, there's a lot of creatives in the room from what I understand, and I'm sure you understand us writers make a ton of money. So I had to, and I still do, I had to offset my journalism career by doing a number of other things. So I worked as a music producer and a DJ for a long time. I also worked as a fitness instructor at Equinox Fitness in New York and Los Angeles. First teaching yoga, but then I got into studio cycling, kettlebells, just different ways of movement. But yoga was the one that got me. So I spent a long time, 17 years teaching, up to 20 classes a week, traveling, doing that as my life. That kind of brought me into the wellness industry. And wellness is a weird term. It kind of signifies a lot of different things, but usually it operates somewhat outside of mainstream medicine. And I'm very critical of it, but I also understand the benefits. I had gone to 400 or 500 chiropractic sessions when I was younger because of disparities in my body. Yoga is what made me stop needing to go. So it was very important, like emotionally, physically, on a number of levels. During that time, though, I also started working with a lot of natural foods companies, doing marketing work, DJing their events, just being around, traveling with probably a lot of companies you know, and a lot of charismatic figures who are now be called influencers. And that led to an eating disorder that I suffered from for about 15 years. Now, interestingly, women usually suffer from eating disorders more than men, but it's more even than people think. Men just don't admit it. Or because with men it presents differently, it's not as much of a focus. But the wellness industry is really good at creating eating disorders. And the specific one that I suffered from was called orthorexia. Now, it's not in the DSM. In the DSM, it would probably be called more avoidant eating. But basically, you take foods that are considered toxic and you remove them from your diet. And you keep doing that until you're stressed all the time and you have very few foods you can eat. Now, I was a vegetarian for 20 years. I was a vegan for almost 2 years. And part of that was driven by my eating disorder. I don't talk about diets. I don't care. People, that is something that I think is way too discussed because people think they know good nutrition, and I am not a clinical nutritionist. But my movement into veganism was definitely part of my eating disorder because I was constantly removing foods that were toxic. At some point, I ended up in the hospital a few times after passing out from having anxiety disorder that was related to the eating disorder because I wasn't getting the right nutrients. Now, like I said, I would be a little bit critical of the wellness industry, but I don't think people go in there to do that. But I think we have an environment in this country where we really don't understand chemistry and nutrition. And I think we're sort of the victims of our own success sometimes. We have the ability to eat foods from everywhere at any time, at any day of the year. Historically speaking, that's pretty new. And unfortunately, that creates a lot of neuroses, especially when you get into these echo chambers that have been created and given steroids by social media. So that was where I spent a lot of my time in wellness, teaching, really benefiting, meeting amazing people, but also on the back end, suffering from a lot of it. In 2005, I read a book called This Is Your Brain on Music. And it was by the neuroscientist Dan Levitin, and that really got me into science and reading science. As I said, I offset my career over and over again as I was able to find work. You might not believe this, but music journalism also doesn't pay very well. So after a decade as a world music journalist and as a DJ and working in that field, I pivoted to health and science journalism. And for about 10 years, I worked for a company called Big Think. As a contractor, I wrote over 1,000 articles for them, and predominantly around health and science. And that got me really into reading studies, interviewing doctors, interviewing healthcare professionals. Okay, so that's sort of the background of how I got to 2020. So very early in COVID, like a lot of people, I had lost my career, most of it. I still had some writing gigs, but I was teaching predominantly at Equinox at the time in Los Angeles. My wife was an events director at a hotel in Los Angeles, so we lost like 75% of our income overnight. And so I was finding writing gigs, doing what we could to survive. And then, I think it was in May, a documentary came out called Plandemic. You might have heard of it. I had some experience with a filmmaker from Los Angeles. He had spoken at a festival I was the creative director of a number of years before. I knew the anti-vax community pretty well in Los Angeles because I had covered the measles outbreak in 2014, making a comeback yet again. And I contacted two friends of mine and I said, hey, this movie I feel like is going to just go everywhere. We knew the people involved. We knew the community because I was in Los Angeles and one of my co-hosts still was in Los Angeles at the time. And I said, why don't you come onto my podcast and let's talk about this? And so we did, and that became Conspirituality, which 600 plus episodes later is predominantly what the three of us do for a living. Now, it's doing good so far. There it is. So, starting a podcast where you're addressing the anti-vax movement, which is not all we do, and I'll define conspirituality in a moment for those of you who don't know. We get a lot of pushback from people, predominantly in wellness or contrarians or skeptics, who say, oh, you must be shilling for big pharma. I would love some pharma money because they have a lot of it. Send it over. But it's funny because at the time I actually wrote a book on psychedelic therapy where I was very critical of pharmaceuticals. And I am very critical of for-profit healthcare specifically, which I'll tie in, and that's where the parallel theme of this talk comes in. Now, conspirituality, for those who don't know, in 2011 the term was coined by two academics in the UK, and it just basically represents this movement of predominantly left-leaning wellness people, predominantly female, and right-wing conspiracy theorists, predominantly male, and where they converge and their ideologies mix. They pointed back to the 60s as a time where it really bubbled up, and you see that in things like the John Birch Society and the hippies coming together being anti-fluoride, for example. In our book, we looked back and we identified about 200 years of this phenomenon. So of course we're looking backward and applying a term, but it's this idea. Early on, we would call it more horseshoe theory. Some scholars have called it diagonalism now, which I think is a more appropriate term, which is where the intersecting ideologies come together of seemingly disparate communities. And so that's the foundation. All three of us have different focuses. My two co-hosts were indoctrinated into cults earlier in their life, so they have real expertise in cult indoctrination. And again, my focus is mostly on health misinformation. And so we start this podcast, and as I mentioned, a number of critics say we're shilling for pharma. And so it really made me think about any sort of ideology. I don't want to apply conspiracy theories broadly because I think being skeptical is very important. But any sort of ideology that comes up and becomes popular has to be rooted in something that's meaningful. And that is where the wellness influencer enters, because we are the only developed nation in the world that doesn't have universal health care or some form of it. We actually have 4 different types of healthcare systems trying to operate under one system in America, and that's partly why it's such a mess. We also have a problem of long-standing racial and gender issues in healthcare with disparities. So it makes sense to me, both as a patient at Providence, which I have a lot of problems with here in Portland, but also just in general of why people would be skeptical of healthcare. I've talked to a lot of people who have had horrible outcomes. I've had really bad experiences. I've also had really amazing experiences. Going through cancer is a difficult situation, and at the time I had the best possible team working with me. So you have to balance these things, but what the wellness influencer or the contrarian is able to do is exploit those certain gaps in knowledge and make it seem as if the entire healthcare system is set out against you. It's something that we see all the time, and it's extremely dangerous. The last thing we do in our book is we talk to people who have lost loved ones because instead of going to an oncologist, they went to a Joe Dispenza workshop because he told them that they could think their way out of cancer if they did it right. And they ended up dying because they went to oncology too late. And that to me is a real shame. So it's this balancing of understanding that, again, I'm very broad term, but the wellness industry offers people a lot of great things. But so does healthcare. And there's going to be good players and not so good players across the board in all of these. Now, unfortunately, what I think social media has done is it's flattened that playing field. And what contrarians are really able to do is say, everyone over there is not looking out for your best interest. We are. So let's bring it back to the wellness company and what they're doing with retatrutide. It's been very interesting watching. I should have pointed this out. My eating disorder came from the fact that I grew up overweight. I was bullied. I went through a lot of shit when I was young for being overweight. And then in high school, I grew 8 inches in 1 year and sort of evened out. So those early mental imprints stick with you for a long time, though. So it's been very interesting as somebody who has gone through that, watching how the wellness industry has sort of weaponized and monetized solutions for weight loss. And this goes back decades. I mean, diet books and all sorts of, Dr. Oz for Medicare, like he was selling green tea supplements 2 decades ago on Oprah, right? And finally, we have something that is actually making really good impact. And I know it doesn't work for everyone, but things like Ozempic and Wegovy and Mounjaro, I've heard from dozens, if not hundreds of listeners who have been like, these have changed my life. If you come over into wellness land where I operate, they'll tell you that taking a pill means you don't have the discipline to do it right. You're not able to do it. You don't have the willpower. But if you took their workshop, you would learn how to do that. Or if you bought their supplement, that would actually help you lose weight. So it's interesting that the wellness company would be offering this because they have ties to Robert F. Kennedy Jr., who's one of our main targets. We actually wrote a Time magazine article about him in July of 2023, warning about the problems of him. So watching where this movement has gone, which we've been tracking for 5 years, has been extremely frustrating, to say the least. They have ties to him, and Kennedy has come out saying Ozempic is bad for you for a number of reasons. Again, it's the whole willpower argument. But we have this intervention, and now you have this company selling retatrutide. But on the marketing, they say it's injection-free because that's what they're built on. They're built on the fear of the needle penetrating the skin. There's a writer named Eula Biss. She is fantastic. She wrote a book called On Immunity 7-8 years ago. She pointed out that the anti-vax movement really gets a hold, especially with mothers, because they use the image of something penetrating the child. It doesn't matter what's inside of the vial, inside of the needle, it's the image that gets you. So the wellness company builds their marketing around that image. So they market retatrutide as injection-free, and they're selling an oral version. Now here's the problem. The oral version has been tested. When you put it in your mouth, the enzymes in your mouth break it down before it gets into your bloodstream. It doesn't work. They're selling $500 a month supplement bottles of this because they're making people scared of the injection and saying this is working. Now here's the other thing. As I mentioned, it's in stage 3 trials right now by Eli Lilly. The tests have been good for weight loss. They compare it to Mounjaro and Wegovy. And there's been a slightly better instance of weight loss taking retatrutide so far. But the side effects have been much worse, including increased heart rate. So there might be some cardiovascular problems with this drug, which is why it's in trials, because we need to figure that out, whether or not it's going to be acceptable for people or not. And this was one thing that I find over and over again, is that the wellness industry wants the prestige of science without actually doing science. And so you have this company who's taking this product that is a pharmaceutical, and they're selling it, I don't know how, but given their friend now runs HHS, I'm guessing there's not going to be a lot of oversight for the next few years. And they're able to do this. A good friend of mine, Dr. Andrea Love, she's a cancer immunologist and biomedical researcher, but she writes a lot about chemophobia. And it's this idea that certain chemicals are bad, certain chemicals are good. And what the wellness world never does is talk about the dose level. So they'll take any sort of toxic chemical that, sure, if you're taking gallons of it, it would kill you. But at the dose level that it's at, it's either helpful or it's irrelevant if you're talking about something like an adjuvant that's just helping a vaccine, for example. But the wellness world is able to exploit that gap in knowledge when it comes to chemistry and use an approach of fear-based marketing. And I think that's really sad because from my experiences in this world, people just want to try to be healthy. And they're also really good at manipulating data around that. Because if you think about it, yes, there are more chronic diseases now than before, but there are also less other forms of chronic diseases. There are more certain forms of cancers, but the HPV vaccine is looking very good right now for working with cervical cancer, for example. They take data and they only highlight one thing. Here's an example. Have you heard this, that in the EU there's only 400 food ingredients allowed, but in the US there's 10,000? Have anyone heard that stat? Yeah, it's like, whoa, what are we doing to our food? And I'm getting the numbers slightly wrong, it might be 600 in the EU. Here's the funny thing. In the EU, what they're looking at is data on the acceptable number of food ingredients. What they're doing in the US is they're including packaging in that number. So the box, the plastic in the box, any other thing, anything along the supply chain is counted as an ingredient in that data. This sort of data manipulation happens all of the time. And so that's where I kind of want to land here, because I think a lot about how people can better understand what's happening in that sort of fear-based marketing. And it's really difficult because if you're someone who consumes, there's one stat that came out from the WHO that 90% of Americans turn to social media for some sort of health or medical advice. And that is not the communication platform for understanding the nuances of health and science. In fact, 4 years ago, I gave a talk in front of the WHO, in front of their marketing and social media teams. And they're asking me how to fight wellness influencers and combat them. And I'm like, you're the WHO. That's the thing about having a niche, though. So I spend a lot of my time actually thinking about those things. And unfortunately, we're not really built for that sort of nuance, especially if you have other things going on and you just have a problem that you're trying to solve. So it's very challenging. But I want to sort of wrap it up here, and then we'll do some questions if you have any, with my heuristics for how to identify this sort of misinformation. First off, don't trust people who say, a study says, and then you see a link for their study on the website. I see this all the time. One of my hobbies is to go to websites, click on the studies, and then read them. Because the company, check out AG1. I've been covered a lot in the press by AG1. There was an Andrew Huberman article that came out in New York Magazine. I was in that talking about AG1. And I've talked to a number of different press outlets about them. Because if you go and you actually read the studies, they're all done on human models or on animals. And they're creating new terms that aren't actually scientifically accurate. But it's all marketing. So they can say, oh, these 75 ingredients work synergistically. That's their term. They did a whole paper on synergy that I broke down during an episode. It means nothing because those ingredients have never been tested together. That's what I mean about chemophobia or the lack of understanding of chemistry. Just because something does one thing and this thing does the other, when you put them together, that doesn't mean they're going to do the same thing on steroids. That's not how it works. So going and actually vetting and reading the studies is really important because this is the gap that frustrates me the most, is that wellness is very science-y. They want the prestige, as I said. I believe there are a number of designers and artists in this. My wife is a UX researcher, and she works in marketing, but she works in the pharma industry specifically. She works in accessibility, so helping colorblind people navigate, when they're designing apps, things like that. Part of what she does is the inserts into pharmaceuticals. I can see how many months of work going into creating that insert that no one reads about a pharmaceutical. But it has to be for legal reasons. Every single word has to be specific and perfect, or they can get sued. And there are actually people out there who look for gaps in that to go to sue companies. That's how they make their living. The wellness industry has none of that oversight whatsoever. So when Robert Kennedy comes out and says supplements they're trying to hold them back, it's like, what are you talking about? You don't have to test anything. They're barely regulated. The only time you get a warning letter is if people start dying from one, which has happened in the past. So reading those studies, if there are people you follow that you like, they say good things, that's great. But when they start making health claims, because again, I want to be very clear that there's a lot of goodness in this world, in this field of wellness. But it's when they start making specific health claims that my antenna goes up. So go read their bios. From my experiences, every medical professional in the first paragraph of their bio will have where they trained and the exact degree that they have so they can talk about what they're an expert in. I've interviewed well over 100, maybe a couple hundred by now, medical professionals, and every one of them at some point in an interview when it came up would be like, that's beyond my field of expertise. I wouldn't talk about that. I'll talk about what I know specifically. And you can find it in their bios. What happens in wellness world when you read the bio? It's an anecdote. I had this problem and then I started taking this and I felt better. It cured me. If that's true, that's wonderful. I really mean that. But that is not science, and that does not give someone the capability to then go treating other people, which I find especially egregious. I have a nonprofit that I founded last year called Cyrus Health. I have another podcast called Clarity Lab, and it's seasonal, but a couple of people that I had on this season all said the same thing. If a claim sounds too good to be true, it probably is. I have a special hatred, probably isn't too strong of a word, for people who say they can cure you from cancer. I say this as a cancer survivor. I say this with 3 family members going through cancer right now. One of them stage 4, not a great situation. And I know what goes into that field and how hard oncologists work and how challenging understanding cancer. I mean, cancer isn't one disease. It's over 200 diseases under a general name. If you want to learn more, read Siddhartha Mukherjee's book, Emperor of All Maladies. It taught me a lot. And the idea that people would say that their green juice cures cancer or celery juice or all of the different things is really egregious. So if they're saying something that just is like, wow, it's kind of like you'll lose 50 pounds in 2 months. Like these claims they don't honor biology, and they don't honor who we are as animals. So that would be an important one. And the last one is a heuristic that I came up with very early in the podcast, is watch what they say and then watch what they sell. And unfortunately, We can see this with the entire MAHA movement right now. They're saying that America is going to be healthy. Yesterday, Kennedy just announced he's cutting 10,000 more jobs under HHS. So where there are 85,000 jobs, now there will be 62,000 jobs because a number of them have already been cut. There have been so many people I know who have lost their funding and their grant research. There's a page on the HHS site showing every single grant that has been cut, and it's really tragic. A lot of it to do with chronic diseases as well, which makes it even more frustrating that the MAHA movement is built around the idea that we're going to battle chronic diseases. So I did this one thing after the MAHA congressional panel was in September, I believe, with Ron Johnson. And I went and I looked, every single person who spoke with Kennedy that day sells supplements, every one of them. And now they are in charge of our health, the public health. And what I find so frustrating about this is all of the researchers that I've talked to over the years, the number one thing to make us healthier would be universal health care, period. A couple months ago, I did this research for one of my articles. I looked at the map of food access, obesity levels. Obesity isn't always an indicator of disease, but it can be, so it's an important component. Poverty levels and healthcare outcomes. And I laid them all on top of one another, and they're the same map. And so the idea that, what did Kennedy say, that if everyone got a gym membership, we'd solve the chronic disease epidemic overnight? Or if we all started farming? Because I know we're all going to do that. We'd all be cured overnight. If it sounds too good to be true. And the fact that when I look at all of the people involved in this broader space, they never address the social determinants of health, or if they do, they only use it to sell their products. So if you think about when you hear some of the statistics, oh, this many people suffer from this, well, look at their income levels and look at where they live, because there's a correlation there. But you're selling $500 a month weight loss supplements? Like, that's not your target audience. You're using the people who have the worst healthcare outcomes, who don't have access to healthcare, you're using them and their statistics to sell to an audience that predominantly doesn't need it. And that is really the most frustrating, and it's really what drives the work that I do. Because we need universal healthcare. So how many people have heard of Oregon Healthcare for All? Oh, good. And I didn't see any of you at the meeting last night. Last night was my first meeting. It was the largest meeting I found out. 14 of us came. There's another one tonight if you go to the site. They're doing a pub crawl this week, which was nice. But it's something, hey, whatever gets people in the door. It's something that I've spent years advocating for. And we have, in 2022, it was the first time I voted as an Oregonian, we have written into the Constitution that by 2027, we have to have universal health care in Oregon. Now, if you know your history in Canada, which has socialized medicine, in, I forget the year, late 40s, early 50s, they tried it in Saskatchewan, and in a couple years, it was an overwhelming success, and all of the other provinces followed suit. So we have an opportunity here right now to implement universal health care and be a inspiration for other states to follow suit, because I don't think this federal government is going to go for socialized medicine, but we can actually do that here. So check out Healthcare for All, Healthcare for Oregon for All. It's a very grassroots organization right now. Everyone there is just kind of in the same boat I am, just being like, we need to implement this. But watch what they say, watch what they sell, and if they're demonizing something, and then at the end of the video, they're selling a solution, that should be a red flag to give pause, to be like, hey, let me look a little more into this. Because I feel like health is very complicated, biology is complex, but Everyone wants to feel good in their body. Most of the time, something that comes quick isn't going to have good results. But if you take a little bit of time to look into it, you might just find that maybe there's a little conflict in what they're selling. And don't talk bad to veterinarians. Because that's what I did this week on the podcast. There's a whole anti-veterinary movement that I don't have time to talk about. But be nice to veterinarians. I just have a puppy, so I'm especially. So that's the broad talk. Do we just go into Q&A?